Good evening, everyone. My name is Judy Gassner, and welcome I'm with the Torrance Memorial Foundation, and thank you all for zooming in and joining us for our lecture. I do have a very, very special thank you to Torrance Memorial's ambassadors, Torrance Memorial's Miracle of Living at the Beach, and our new friends that are partnering us this evening, GrowingGreat. To help make sense of this pandemic, we knew that regardless of what topic we were to have or present, we had to mention COVID and the hospital. We also knew that it would be logical to have an infectious disease doctor who has been invaluable during the pandemic and a true leader at Torrance Memorial to discuss the coronavirus and where the hospital is today. But before we begin, it gives me great pleasure to introduce our moderator, Dr. Anna Mellor.
Welcome, everyone, from your home. This evening, we are graced to have three fabulous speakers who will shed some light on topics that are currently quite dear to our hearts. COVID has been on our minds and intimately integrated with our day-to-day lives since March. Dr. David Rand will speak on COVID and some similar related topics. Good health is more than just managing disease, however, and Dr. Nicole Alexander Spencer will discuss the concepts of integrative medicine and the mind-body approach through lifestyle, exercise, and anti-inflammatory diet. And we all know the benefits of a healthy diet, and creating those good habits in early childhood is key. Grace Sanchez will walk us through how GrowingGreat is working towards this end and conclude the evening with a fabulous recipe demonstration to whet our palates. I want to introduce Dr. David Rand as our first speaker this evening. He is board certified in infectious disease and internal medicine. He graduated with honors from the Keck School of Medicine at the University of Southern California. He went on to do his residency there and fellowship at LA County USC Medical Center. Having more than 31 years of diverse experience as an infectious disease and internal medicine specialist, Dr. Rand collaborates with many physicians and specialists in the Mellor-Rand Medical Group and is part now of Torrance Memorial Physician Network. Dr. Rand is affiliated with the National Board of Physicians and Surgeons for infectious disease as well as for internal medicine. He cares for patients with infections that are difficult to diagnose and treat, many of which are life-threatening. Unfortunately, Dr. Rand is unable to stay for the entire duration of our lecture, so if you have questions, we will address them at the conclusion of his presentation. Dr. Rand?
Thank you all for coming. Excuse me. I'm going to wipe down my mic now. So once again, thank you all for coming. I'm Dr. David Rand, and I am the co-medical director of infection control and the chairman of the Special Pathogens Committee here at Torrance Memorial. For all of you people who have been with us through some previous Facebook Live things, please, this is going to be a very similar presentation. So if you've heard it before, I apologize ahead of time. But more importantly, this is kind of an overview of what we have done initially at Torrance, where we've come through at Torrance, and where we kind of hope to go to with Torrance. So it all began in February when we realized that COVID-19 was a real illness and it was going to be a real problem. So we at Torrance and Infection Control decided that we needed to have a plan. What would happen when COVID-19 hit the South Bay? So through that, what we ended up doing is we developed what's called the COVID Command Center. Corny, yes, I know, but it really fits and it works. This group of people, I was so privileged to be able to work with and collaborate with. multidisciplinary. It was from administration to my partner and myself, laboratory, other physicians, just a whole host of people that got together on a daily basis, sometimes multiple times during the day, and more meetings than you could throw a stick at, to try and get our response prepared. And this group, this forward-thinking group that I had the privilege of working with, was able to come up with a plan that was very seamless through an ever-changing environment. And as you guys know, I mean, in the early phases of COVID, things changed on a daily basis. I mean, we were really hopping. And so this group is what started it all, and it continues today. We meet weekly now, and who knows, as things ramp up in the next viral portion of our winter, we may be meeting more often. We'll have to wait and see. So we started with reconfiguring our emergency room. And what we did is basically we broke it down into a COVID side and a non-COVID side, so that when people would come to triage, they'd be asked their questions, and anybody with respiratory symptoms would be directed to the COVID suspect side, and those that weren't would go to the non-COVID side. The reason for that is we wanted to be able to maintain our ER, and be able to function the way that a normal ER does. Now, honestly, in the first few weeks of COVID, people were terrified of coming to the hospital, and so we were a little quiet in terms of regular ER visits. After that, what we did is we designated certain floors of the hospital as COVID floors, and we developed paths of travel from the ED so that there was a specific way we would go from point A to point B. And the reason for that was we wanted to minimize exposure to anybody else within the house, patients and staff, and everybody else included. On those floors were special nurses and I really have to give a shout out to them, because boy, without them, I couldn't have done anything that I did. And I love you all, you know that. And they were specially trained in donning and doffing, which means taking on or putting on and taking off our PPE and equipment, and caring for COVID patients. In the very beginning, and even to this day, we worked tirelessly to try to maintain our PPE supply, and we were very, very successful. We had to do some switches. We had to make some decisions again on the fly. But throughout the whole pandemic and to this day, I have never had a lack of PPE. It's been different sometimes, but never had a lack of it. And I credit once again the COVID Command Center and everybody involved for making sure that that would happen for someone like me who has to take care of COVID patients on a daily basis. Then when we began in the beginning part of May to open elective surgeries back up again, we developed a system by which all elective surgical patients would get tested for COVID prior to their surgical intervention. It was 5 days before surgery, and there are specific reasons why we chose that number. But now, and even to this day again, everybody getting an elective surgery will have a COVID screen prior to that surgery. The reason I go over all of this stuff is really important so that I can tell you that Torrance Memorial is an incredibly safe place to be. And I think it's really, really important, seeing what we saw in the beginning of the pandemic with people being terrified of coming to a hospital. I can tell you with the utmost confidence what we have done to try to maintain safety, that if you need a procedure performed here at the hospital, if you need emergency care, do not hesitate to come. We've got your back. We really do. And it's safe to be here. So COVID in the South Bay, kind of what happened with COVID? Well, at Torrance, we treated our first patient on March 10th, and we had a very steep rise peaking in mid-April, where we had probably 55, 60 patients in a hospital at a given time. And that's a lot of COVID patients. We had a slow, steady decline thereafter up until about Memorial Day. And then Memorial Day happened. That's also when the state started opening a little bit more. And so after Memorial Day, we started seeing an increase in cases. Was expected with the state opening and things such as that. We knew we were going to see more cases. But then we had social unrest and we had the 4th of July holiday. And so the second week in July, we got a whole nother surge that was equal to the one that we had in April. Same numbers, same amount of people that we were taking care of in the hospital on a daily basis. And it was quite a busy time. There were distinct differences, though, between the two surges. The surge we had in April was really comprised of people coming home from travel, people 65 plus with comorbidities that you all have heard about, and nursing home patients. And that comprised 95% probably of our patient population and those that we were caring for. In the second wave, though, it was a much younger population. We were seeing 40s, 50s, and 60s, and they were equally as sick, requiring hospitalization, but a much younger population. So why did that happen? Well, when you go in and you take a history from these people, their stories were almost identical. They would say, I'm tired of being locked down. I'm tired of wearing a mask. I want to see my family. I want to go to a barbecue. It's summertime. I want to go out and have fun. So people are going to barbecues, bars, and so on without masks and all of the other social distancing kind of things that we recommend. And we had our second week of July, which was really, really something. From that time till today, we really have seen another slow, steady decline. The nice part is that we had another holiday in between, and we were all quite frightened of what that might show. But we really haven't seen the bump that we expected from the Labor Day holiday that we did from 4th of July and Memorial Day. So maybe that means that people realize that what we were actually saying works. So it brings me to my next point. We can protect ourselves, and it's very, very simple to do. Wear a mask when you are unable to socially distance, wash your hands, and social distance when you can. By doing those things, you can truly, truly protect yourself from either transmitting or getting COVID-19. So let's kind of move on to a little bit about what we do in regards to treatment of COVID. Again, this is going to be a real big overview, not specific in any way, shape, or form, but if there's any specific questions, I'd be happy to try to answer afterwards. So COVID-19 is a coronavirus, and like all viruses, it likes to infect people. Its primary mode of transmission is via respiratory droplets, and those are generated by cough, sneeze, and even talking. There's controversy about aerosolization, which is very, very small particles that can infect people. CDC just today put on the website again, they put it on, taken it off, put it on, taken it off, that aerosolization and aerosolized particles can actually be infectious. So I would just like to leave that as being, we really don't have a great answer for that one just yet. But like all other coronaviruses or other respiratory viruses, respiratory droplets seem to be the major infectious source. So these droplets, they either get into your eye, you breathe them into your nose, or you get them into your mouth. The virus then attaches itself and hijacks an epithelial cell, and it takes over its RNA making machinery so that it can replicate itself. And it does it over and over and over again. The cell explodes, viral particles go out, infect other cells, and now you're sick. So that's how COVID kind of gets you. There are two different phases, though, of COVID illness. There's a viral replication phase, and that's when the virus is doing its thing that I just explained. And there's also an inflammatory phase. That's the portion of the illness that is the real devastating part. That's where you see the lung problems, you see liver problems, you see clotting issues, you see liver, renal failure. All of those things because of an inflammatory response. And what's happening, and coronavirus, at least SARS-CoV-2, has a unique ability to activate our immune system much more than other respiratory viruses would do. And so you get this over-exuberant immune system that's trying to kill and eradicate a virus. But that is what actually is causing the vast majority of damage. So in the viral replication phase, we've got two things that we try to use. One is remdesivir. I'm sure you guys have heard about it. It's been in the news, and specifically lately, I think it's been a lot in the news. And it is an antiviral. It's shown to reduce the time of illness to about 8 days from 12. And it now on secondary evaluation has shown to improve survival. So it's got a mortality benefit. So it's a good drug. The other thing we give is convalescent plasma. And I'm sure you've heard about that too. Convalescent plasma is we take blood from somebody who has had COVID, we separate the cells, and what's left is plasma. And we give that to a patient with COVID. What we're attempting to do with that is administer antibody and support somebody's antibody response before their body up to the time that their body can make their own antibodies. There are some products out there, and I'm sure you've heard of the last couple of days, that are monoclonal antibodies that may come into clinical use in the near future. We don't know yet, but it's the same principle. Then we move on into treatment of the inflammatory phase. And that's where we've got a couple of different medications at our disposal. And remember, viral replication and inflammation, they kind of act simultaneously. So although I'm breaking them up into two separate issues, they both happen at the same time. So the mainstay of therapy for the inflammatory phase is steroids. At Torrance Memorial, we use solumedrol or methylprednisolone, but any steroid actually will work. The study trials and data show that dexamethasone is the one that was actually studied in the RECOVER trial out of Europe. But we've had great success with methylprednisolone. It's kind of a widespread anti-inflammatory, so it hits large portions of our immune system to try to blunt that inflammatory response that we call cytokine release syndrome or cytokine storm. Another medication called tocilizumab, don't worry about the name, it doesn't really mean anything, is a very elegant monoclonal antibody that hits a specific portion of the immune system to try to mitigate this cytokine storm. And in order to receive either of these medications, people have to meet certain criteria. Steroids, for instance, if you give them too soon in the illness, actually cause harm. So there's a lot of things that we look at before people get certain types of medications. Remdesivir and convalescent plasma are generally best when given within the first 7 to 10 days after illness has begun. So that's kind of how we end up treating COVID. The other thing that has been important for us throughout the country and at Torrance Memorial is in the early phases of the pandemic, we were putting people on mechanical ventilation at the drop of a hat. And that's why you heard all of the worry about, are we going to run out of ventilators? Well, over time, we've learned some stuff. And mechanical ventilation is not without its own complications. And so what we've done over the last several months is try to get away from mechanical ventilation. And we actually are doing that much less now than we were doing in the initial portion of the pandemic. We're using different oxygen delivery systems, the high flow oxygen delivery. And we've even developed a different kind of in between high flow and ventilatory assistance at Torrance that's called BiPAP. It's something that's known to many physicians, but we've got a special way of doing it for COVID patients. So that's kind of how we do things in terms of treatment at Torrance Memorial. So where do we go from here? Well, that's a very interesting question, isn't it? We're coming up on a very scary time for all of us, and that's our respiratory viral season. Some of the models that people can find online, the University of Washington, a lot of different universities have models and predictions. Some of them are really dire. I think the University of Washington at one time had predicted 3,000 deaths a day during the influenza / COVID time of year, which would be coming up. I personally believe are going to be very, very behaviorally driven. So if we've learned anything from our last surge, where masking, social distancing, and washing our hands really does mean something, and it looks like it does, then we could have an incredibly mild viral season, which includes influenza and all the other respiratory viruses that we have to deal with during the wintertime. If we haven't learned our lesson and we don't do those things, we could be in real world of hurt. So I think what I'd like to conclude with the three. Oh, actually, let me back up a little bit. Everybody's going to want to know about a vaccine. Vaccines certainly are out there. They are in trial. There's 4 vaccines that are in big, large phase 3 trials. One vaccine is what we call an adjuvanted killed viral vaccine, which just means you got a dead virus and a chemical in there that helps to boost your immune system to it, to really cool messenger RNA viruses or vaccines. So 4 of those are in phase 3 trials. My personal opinion is that I don't think we're going to actually see a viable vaccine. I kind of go along with Fauci and Redmond on this one until probably the early part of the second quarter, maybe mid portion of second quarter of next year. I really don't think we're going to have one by the end of the year. So that's why, again, masking and hand washing and social distancing is important. So again, the 3 things that I really want to hammer home. Torrance Memorial is a very, very safe place to come. So if you need any medical care whatsoever, be it an outpatient x-ray versus a surgical intervention versus you got to get to the ER, don't hesitate to come, because we've made it as safe as humanly possible. And second, you can protect yourself and do so. Mask, hand wash, and socially distance. And then the third thing that is really super important, especially this time of year, get a flu shot. The reason we are really, really hammering on flu shots this year is there is the potential for getting co-infected with COVID and influenza. I do not ever want to have to see a patient like that. That would just be just beyond pale. So even though influenza shots are not always completely protective, we do know that if you get a flu shot, you will do better if you get influenza than if you never got the shot. So with the potential of getting both COVID and influenza at the same time, please do something once again to protect yourself by getting a flu shot. With that, I know I've done a whole lot of talking. I would be happy to take some questions.
Thank you, Dr. Rand. Is his mic open? Is on? Okay. So a question from one of our members. Does taking vitamins such as vitamin D, C, or zinc help with COVID treatment or prevention?
So I think I'll probably defer that question, but what I can tell you is that what we have, there's a trial out of Columbia University. It's a small trial. And what they found is that people with low vitamin D levels actually had a 45% greater chance of dying from COVID than those that had normal to mid-range levels, so about 50 or so. So we do use vitamin D in our treatment protocol. Zinc, have we been able to prove that it works? No, we have not. Do we have theoretical data to support it? Yes, we do. So zinc is another part of what we can use. Vitamin C has been looked at probably as long as I've been out of medical school and many decades before. Again, proof is difficult to come by. Will it hurt anybody? No, absolutely not. I can't say how much it would help. I just can't prove it.
Thank you. Our next question is, how can we know if any of the recommended or available vaccines are going to be safe for prime time?
Really good question. We were talking about this a little bit before we came on tonight. So I think there's an element of trust that we have to have. My belief is that and maybe I'm being naive too, that big pharma, who is doing all of the research for this, they're going to want to be able to make money off of this in the future. And if they put out a vaccine that is not safe, it's going to be devastating to their bottom line. So in that regard, I think that they're going to do everything they can to maintain and ensure that they have a safe vaccine to put out. Also, it's a fine line. We want to get a vaccine out as quickly as possible, but if we get one out and there's a lot of side effects, then people are not going to take it. And we will be dealing with COVID for God knows how many years thereafter. So I think when the CDC actually comes out and endorses that this is a viable vaccine and that it is safe and it is FDA approved, I think we can take that as a pretty good assurance that it's as safe a vaccine as is possible.
Our next question is regarding the upcoming holidays. So with holidays approaching. What are your thoughts on traveling via airplanes? If indeed we have another year of this ahead of us, how do we create a sense of social connection without spreading the virus?
Another very good question. I think it's difficult. There are studies about air travel, and air travel right now is incredibly safe. So if somebody is planning on taking a flight to go see family, as long as you wear your mask, and they're going to make you do it anyway, that air travel is very, very safe. So I wouldn't have a problem with that. Where I get a little nervous and itchy is, again, when we go back to the July surge, what we saw was a lot of family gatherings. And the problem is it's degrees of separation. So the people that you live with, you know what they're doing, and you're around them all the time, and you know they're either masking or not, and so on and so forth. But you get to, Sister Sue, well, you're not so sure what she's doing. And then Sister Sue's cousin who's coming over for Thanksgiving, you definitely don't know what they're doing. So it does get a little dicey. So in those situations, and especially during Thanksgiving, because probably it's going to be colder and people are going to be indoors, the ventilation is not going to be as good. That's where social distancing is going to become paramount. I would even think that it's not a bad idea to go ahead and wear a mask, although the question being, how are we going to be able to feel, nice and cozy with our family with a mask on? This just may be that Thanksgiving you're going to have to get through it, because I know this is not going to last forever. And I would say that in order to maintain safety, masking and social distancing in those situations is the safest.
Our next question, is COVID more dangerous for people with autoimmune disease because of the inflammatory surge that you described earlier?
We haven't described that in any controlled trial. I would say that somebody with an autoimmune disease is generally on immunosuppressing agents. And so if you're on a biologic, or if you're on prednisone, if you're on Plaquenil plus methotrexate, which is really more of an immune modulator as opposed to a suppressor, those are the people. So somebody being treated for an autoimmune disorder is more likely to catch it. Now, the question is, are they going to have a cytokine storm because they're on these medications? We don't know. It's just, I wouldn't be able to tell you.
Does the pneumonia vaccine help prevent or mitigate the symptoms of COVID?
No, completely different organisms. Still important to get. Anybody 65 years of age and older, or with other types of illnesses, even at an earlier age, we know that pneumococcus, which is what the pneumonia vaccine protects against, is the most common cause of pneumonia. And it's again, a vaccine that will help prevent secondary problems with COVID. So I guess in that sense, yes, it would help.
So I think those are all our questions this evening. Dr. Rand, thank you so much for taking the time to be with us.
Thank you.
Thank you. Our next speaker this evening, we are so lucky to have Dr. Nicole Alexander Spencer as part of our Torrance Memorial Physician Network. She is board certified in family medicine, completed her undergraduate training at UCLA, went to complete her medical degree at Howard University College of Medicine. She after that, completed her residency in family medicine at UCLA, went on to get a master's degree in spiritual psychology at the University of Santa Monica. Dr. Alexander Spencer completed a fellowship in integrative medicine at the University of Arizona under Dr. Andrew Weil. Dr. Alexander Spencer has additional training in urgent care medicine, adolescent health, women's health, and weight loss medicine. She is a member of the Torrance Memorial Physician Network. She is a strong supporter of holistic, comprehensive health care for her patients. She is passionate and believing that the mind body are connected, and when one system is ill, your body is off. Dr. Alexander supports her patients in getting adequate rest, having balance in their lives, encourage healthy relationships, being active, and eating healthy food options. She is a San Diego native and chairs the Integrative Medicine program at Torrance Memorial Medical Center. Welcome to Dr. Alexander Spencer.
Hello, everyone out there in Zoom land. Well, isn't it a great night to learn about integrative medicine and the backdrop of COVID? I'm also on the board of GrowingGreat, so it's exciting that we're all collaborating tonight. So let's start. My goal tonight is to contribute to your knowledge and enhance your well-being during this time of COVID. And global pandemics, and this one has caused a lot of stress. There's uncertainty, there's financial stress, there's isolation, and we've noticed a rise in mental illness such as depression and anxiety. And there's been an increase in suicide as well. So what can we do integratively to address these issues? We have helpful tools to assist the body in healing and dealing with stress. And we have strategies to enhance the immune system and decrease the severity of viral illness. So what's integrative medicine? Integrative medicine is a healing-oriented medicine. It takes into account the whole person. It considers their lifestyle. It's evidence-based, so scientific. It takes that there's a therapeutic relationship between the doctor and the patient. And we use complementary and alternative treatments like acupuncture, Chinese medicine, massage, and supplements, just to name a few. So as Dr. Rand talked about COVID-19, it's a large, very highly infectious, moderately virulent disease or virus, and it binds the upper respiratory tract and replicates. And so what can we do to address this? And we'll talk about the research. So there's research going on that focuses on antivirals, anti-inflammatory drugs that target the attachment and viral replication. And as Dr. Rand was saying, we're working on a vaccine, and that's going to be very important. But integrative medicine, we have strategies that focus on prevention, enhancement of the immune system, and treatments to shorten the duration of a viral illness. Again, there's no published human trials for integrative medicine specific to COVID, but they're underway. So most of this research that I'm presenting tonight or data is from studies from the flu and the common cold, those type of viruses. Again, with all these recommendations, we still have to follow the public health guidelines given out by the CDC: physical distancing, wearing your mask, hand washing, and getting tested if you feel sick. Those most at risk, 65 and older, elderly, those with comorbid conditions, I recommend, shelter at home in place and be safe. So let's discuss some integrative medicine. This is, we'll talk about how your lifestyle affects your immune system. We'll suggest tips to improve your lifestyle in order to enhance your immune system. We'll talk about the anti-inflammatory diet. I'll discuss supplements, which are best to use during a viral illness, how they work, and which ones to avoid. And again, no integrative measures have been validated in human trials specifically to COVID-19. So risk reduction, mind, body, and soul, very important. They're totally connected. So mentally, what can we do to decrease stress? We can do yoga, meditation, deep breathing, exercise. All this mentally you have a natural endorphin and it gets the stress out. Socializing is very important. People are feeling isolated. I encourage people to socialize. If Zoom and FaceTime don't work for you, then have a social distance barbecue. But you need to talk to your friends and you need to stay connected. Connect with nature. Going for hot walks and hikes outside is so important. It helps change your mood. It lifts it. Taking breaks, vacations, staycations, whatever you can do to prevent burnout is really important during this time. focusing on gratitude, because if you're focusing on gratitude, you can't be focusing on things that are negative. Laughing and like watching Saturday Night Live or Netflix, it's so important because it enhances your own happy emotions. And that's really important right now. Instead of focusing on news, I would say limit news and media as much as possible, because sometimes it can have a negative twist. Journaling daily helps release your fears. Sometimes it's necessary to talk to a therapist or professional, and they can help you cope with your issues and challenges a little better. And again, limit social media, because that can lead to increased anxiety, depression, isolation, and fear of missing out. So physically, you need to have a self-care routine. It's very important. Exercising, again, it's going to check a couple of boxes. So I think we should exercise. Eating an anti-inflammatory diet is key, because you want to fuel your body. So then your cells are healthy and your immune systems are healthy. Limiting alcohol, caffeine, and prioritizing sleep. That's one of the things I really emphasize, because when you shorten your sleep cycle, you increase the risk of infection, because during sleep you secrete melatonin, which is an anti-inflammatory. And studies show that those that have a persistent lack of sleep, 5 hours or less, have a 450% increased risk of illness. And lastly, I want for the spirit and to feed the spirit is giving back, volunteering, meditating, and prayer. So risk reduction. So let's talk about food. The anti-inflammatory diet is the cornerstone of integrative medicine, because it is, again, fueling our body. And what we feed our body is a building block. So it's made up of complex carbs, proteins, and good fats, fruits and vegetables. So the veggies and fruits, you should have about 5 to 7 servings, which is about a half a cup, and that's every day. And vegetables and fruits are full of flavonoids, which are antioxidants. So they're found in green leafy vegetables, dark yellow vegetables, berries, oily fish, nuts, green tea, red wine, but please limit red wine to 1 or 2 servings a day. And if you don't drink, you don't need to start drinking. Pro-inflammatory foods are foods that we should avoid, such as red meat, processed foods, sugar, sweet beverages, and refined grains. So acute inflammation is necessary for the body to repair and heal, but chronic inflammation leads to tissue damage and increases your morbidity and mortality. So with studies that follow the CRP, which is an inflammatory marker, it shows that chronic inflammation is worsened by our diet, a poor diet. So I would recommend, if you were to start an anti-inflammatory diet, you can enjoy Mediterranean food, Japanese food. Those are really great places to start. And you can Google anti-inflammatory diets for sample menus. This would be an example of a breakfast, lunch, having a smoothie with unsweetened Greek yogurt, spinach, berries, lunch with lots of salad. Lunch would be a salad with a variety of vegetables, lentils, nuts, and dinner would be like oily fish, soup, vegetable soup. And make sure you use spices such as turmeric, black pepper, garlic, onion, red pepper, curry pepper, cinnamon, and ginger. Dessert could be dark chocolate, red wine, or green tea. So let's talk about supplements. So supplements and somebody asked earlier about zinc, vitamin C, and vitamin D, and I'm so glad they did, because these are ones that most people have recognized and that you may be already taking, and that we suggest you take to prevent viral illnesses, because they work to enhance the immune system. So zinc specifically inhibits the virus from getting into the cell and decreases its virulence. And the dose is about 15 to 30 milligrams a day. The best form is a lozenge, because it acts directly on the respiratory tract cells. Vitamin C is also recommended because it shortens the frequency and duration and severity of the common cold or pneumonia. In vitamin C, the dose would be 500 to 3,000 milligrams daily, and you should take the highest dose if you have an acute viral illness. Melatonin is also recommended because it's anti-inflammatory. It reduces the oxidative lung injury and inflammation cell recruitment. Curcumin is a component of turmeric. It's anti-inflammatory action and antiviral effects against viruses. And vitamin D activates the immune cells. So how do they work? Some prevent virus from binding, and that would be astrologus, which is decreases the receptors on the cell. Quercetin is another supplement that prevents binding. Vitamin D, again, reduces the receptor activation. Some inhibit viral replication, and zinc does that by inhibiting the viral enzyme and thus replication. And then vitamin D improves the immune system. And then vitamin C, melatonin, quercetin, garlic, green tea reduce inflammation. So supplements to take if you actively have a viral infection could be garlic and curcumin. And of course you can cook with them. They're phytonutrients and anti-inflammatory, help with viral infections. Quercetin is a bioflavonoid found in onion, apple, red wine, green tea, and it's an anti-allergic and anti-inflammatory action. Astrologus is a Chinese herb and increases the immune function. Peppermints for symptom relief. Andrographis is an anti-inflammatory, antimicrobial, and it improves the immune system. Zinc and vitamin C we already talked about, as well as melatonin and vitamin D. There's other supplements that help with stress. St. John's wort is first line for depression, valerian root for sleep and anxiety. If you have problems sleeping, valerian root would be 2 tablets and anxiety would be 1. Melatonin helps with sleep difficulties as well. Supplements to avoid would be elderberry, mushrooms, echinacea, and larch because they stimulate the immune system too much. In conclusion, to maintain a healthy immune system, you need to prioritize sleep. You need to have a good nutrition with an anti-inflammatory diet and use select supplements. Monitor your mood and make sure you're relieving your stress with yoga, meditation, exercise, rest, and seeking additional help if you feel overwhelmed. Follow the public health guidelines, and then make sure you schedule an appointment prior to starting any supplements. And also, I mentioned a lot of things here. Maybe just trying baby steps, 1 or 2 suggestions, exercise tomorrow, maybe starting vitamin C, and I'll answer questions after. Thank you.
Thank you so much, Dr. Alexander Spencer. It's so fun to see just kind of the evolution of medicine these days. Our next speaker is Grace Sanchez. She's going to be joining us from her home. She has an MA degree in teaching with an emphasis in curriculum and instruction from Chapman University. She is an educator. She's a passionate advocate of instilling good nutritional habits in children at a young age and encouraging them in the pursuit of STEM fields. She works with GrowingGreat, and she blends nutrition and gardening activities into the classroom to prepare young students to make healthy lifestyle choices. We're going to have a quick introduction from one of our GrowingGreat's representatives. Of course, yes, Jennifer Jovanovic, and then we'll go on to Grace Sanchez.
Thank you, Dr. Mellor. My name is Jennifer Jovanovic. I'm the executive director of GrowingGreat, and I just wanted to take a brief moment to thank all of you. It's so good to be here tonight, and I especially want to thank Judy Gassner for bringing our 2 organizations together, and all of these wonderful presenters and all the people that work so hard behind the scenes. This partnership really started as an idea from Andrea Zislis from Shade Hotel. She and Michael have been supporters of both Torrance Memorial and GrowingGreat for many, many years. And it's just so exciting for us to come right after that wonderful talk from Dr. Alexander Spencer, because we will take some of those things back to your home kitchens, back to parents whose kids are learning distantly right now, and give you some ideas of how you can apply those with young people. Some of you may know GrowingGreat from our early days. We were founded in Manhattan Beach 21 years ago, and now we are all across the country, reaching thousands of children, especially in low-income neighborhoods. And I don't know how Dr. Alexander Spencer has time to be on our board of directors, but we are very grateful for that too. So all of our programs have gone virtual now. So any of the things that Grace will be talking with you about, we can give you access to as well. So if you have children or grandchildren that might want to do some of these healthy eating activities in their kitchen, we are here for all of you as well. But I'm going to just turn things right over to Grace Sanchez now. And again, thank you all for being here with us.
Thank you again, everyone. Good evening. Here at GrowingGreat, we inspire healthy eating for children and teens. And tonight I'm going to share with you a little bit about what we do. We believe that it is important to establish healthy eating habits in kids at an early age by introducing them to veggies and fruits early, leading by example. If you want healthy eaters, you've got to eat healthy. Teaching the importance of healthy eating, involving them in shopping and preparing meals, and giving healthy options. GrowingGreat started its school garden program in the Los Angeles area in 1999, and since then, GrowingGreat has reached hundreds of thousands of children and their families with hands-on nutrition, garden, STEM, and literacy education. Our 21st anniversary is a celebration of program expansion from preschool to high school in Spanish and English, during and after school, and always with the opportunity to enjoy fresh, healthy foods. Each year, we impact 16,000 students in the greater Los Angeles area. That's 70% in under-resourced communities. We are committed to our families, where a school garden may be a child's only experience with living and growing things. Since 2019, we have expanded our programs to thousands more children nationwide through the GrowingGreat Veggies and Fruits program, sponsored by Del Monte Foods and implemented at science centers, children's museums, and zoos. That commitment has grown stronger through our new virtual program to support parents and children learning at home as a result of COVID-19. We believe every community, regardless of economic status, should have access to fresh produce, and all children should experience the joy of growing fruit and vegetables in their own garden. One of our most popular programs, can you go back a little, Alex, please? Thank you. One of our most popular programs with middle school and high school students is our GrowingGreat Chefs program, which is a cooking class for teens that includes a nutrition lesson followed by hands-on cooking demonstration. Students learn to create balanced meals, learn the benefits of eating a healthy breakfast, label reading, how to find truth in food advertisement, and healthy meal planning on a budget. And as of more recently, students get the opportunity to author their own cookbooks with their favorite GrowingGreat recipes, reviewed or created by our GrowingGreat registered dietitian, and recipes from local chefs like Chef David Lefevre. Chef David Lefevre is executive chef, owner of MB Post, Fishing with Dynamite, and author Jay and Iron Chef Goblet Star Season 2. Today's recipe demonstration is a kale and quinoa salad. You will need Tuscan black kale, 1 cup of quinoa, 2 baby carrots, 1 baby red beet, 1 baby yellow beet, 3 radishes, 2 baby turnips, 2 ounces of toasted pine nuts, 1 ounce of tarragon leaves, fresh squeezed lemon juice, 2 ounces of extra virgin olive oil, and salt and pepper for taste. And welcome to my kitchen, everyone. Again, today's demonstration is kale and quinoa. We will start with our quinoa. Quinoa is very nutritious. It's a plant-based source for protein, and I've already prepared it, so I'm gonna go ahead and put it in my salad bowl since it's already been cooked. Because of time, I kind of prepared everything in advance. And the other thing we're gonna use is the Tuscan black kale. And again, you can see that I've already cut the stems, and we're just gonna slice them into thin strips. And I like using kale because it's very hearty. This is one of my favorite recipes because I can make it in the morning, and at lunchtime and dinner time, it's still very delicious, especially with all the other ingredients I have included. So I'm gonna go ahead and put the kale into the salad bowl. The next thing we are going to do is we are going to wash, peel, and shave all our vegetables, and I've already done that just because of time. So I'm gonna just do a quick demonstration using a mandolin. If you use a mandolin to slice or shave your vegetables, please be very careful. But I'm gonna shave our root vegetables. We have, again, right here I have a radish, we have turnips, we have carrots, we have yellow and red beets. And I love these beets because they have so much fiber, and I just love how they look in a salad. So I'm gonna go ahead and add all my root vegetables into my salad. And since I cut them beforehand, I put them in an ice cold bowl to keep them nice and crisp. And then the next thing we are going to do is we're gonna make our salad dressing. We have olive oil, 2 ounces of olive oil. It's a good fat. We have lemon juice to add a nice citric taste to it. I'm gonna add a little bit of sea salt and some cracked pepper. And I love to make my own salad dressing because I can add as much as of the ingredients as I like. I love lemon, so I added some extra lemon into mine. You go ahead and whisk that. I'm going to add it into my salad bowl. The next thing we're gonna do is add some pine nuts to add a good crunch to your salad. I've already toasted the pine nuts, again, because of time. So I'm just gonna add them on top of my salad and ask for 2 ounces. And then our last ingredient is our tarragon leaves. The tarragon is a herb. It's very, very strong, but in this salad, it is just perfect. So I'm just gonna cut a little bit of that, add it in there. I'm gonna toss our ingredients all together. And again, I love this salad because I can put it in the refrigerator tonight, and tomorrow morning it'll still be nice and crisp. I'm gonna put it on a plate for you to see all the wonderful colors. And here is a colorful, delicious, and nutritious kale and quinoa salad. And thank you for having us.
Thank you so much, Grace, for joining us in your home. So we are going to take a few questions for Dr. Alexander. Dr. Alexander Spencer, our first question is, what is a good daily amount for vitamin D?
Vitamin D, start Well, if you don't have your levels checked, you could start with 500 milligrams. If you're deficient, sometimes we have people start 2,000 to 5,000. And if you're really low, like below in the single digits, sometimes we start you on a super dose, like 50,000. You can chime in too. You know the answer to that, Dr. Mellor.
Yes, thank you. We get a lot of questions from patients about vitamin supplements. Often patients are mixing a lot of supplements together. Do you have a good resource for where you might direct our listeners, our viewers, to learn more about safety for supplements and vitamins when they aren't able to access their primary care physicians?
Yeah, I mean, a lot of primary care physicians may not feel comfortable with discussing supplements and they may not be knowledgeable. So as an integrative physician, I'm available at Torrance Memorial. My panel's still open, so you can send them my way for a consult. I definitely recommend they see a professional because people are mixing and a lot of times it's too much and those can be very expensive and costly. So make sure you make an appointment with me or someone that's knowledgeable with integrative medicine and knowledgeable about supplements. So, that you're not taking too many or the wrong ones or, wasting your money.
Yeah, that's a very good point. And oftentimes patients are getting their supplements on Amazon or non-reputable pharmaceutical companies or nutraceutical companies. So you do really want to make sure that you're getting your your vitamins from a good source.
Yes.
So this next question is on elderberry not being a good thing to take even if you have a common cold.
Now, elderberry is good for common cold, but I was talking in the backdrop of COVID. So specifically to COVID, I wouldn't take elderberry now because we're experiencing the pandemic. So if you have flu-like symptoms, do you know it's COVID? Do you know it's a common cold? You may not know, but historically, elderberry is great for a common cold virus.
Yeah, thank you. Our next question is on melatonin. I do want to piggyback onto what you said earlier about sleep. And I have a little bit older population and sleep is a big, big problem. And what Dr. Alexander Spencer was alluding to earlier is the importance of just the restoration of cell function during sleep. That's when all of our cells recover, we rejuvenate. We know that people live longer if they get good quality sleep and sleep long enough. So I really wanted to, kind of support and emphasize that point that Dr. Alexander Spencer made, because I think that it's something that we are very lacking in our society. So that takes us to the next question posed to you on melatonin. Someone wanted to know what the dosage for melatonin might be.
The typical dose is like what they sell at Trader Joe's is like 3 milligrams, but people can dose between 3 and 10 milligrams, but 3 milligrams or 0.5 and 10 milligrams, but 3 milligrams is sufficient. Usually, yeah.
Great. And can you comment on acupuncture and wellness? Do you have any experience with that?
Yeah. Acupuncture is, it's a Chinese medicine or it's an ancient Chinese medicine technique that they use needles and they introduce them to different parts of the body that is consistent with your chi. So your chi is your life force. And so these needles are supposed to increase your life force and your energy and move your energy because it can become stagnant. I like acupuncture for pain. Treatment for lower back pain is probably my number one referral for acupuncture. But there's a lot of different referrals, like pregnant women that you can't give medicines for and they're in pain or different pregnancy related. We'll do acupuncture to treat different, to treat whatever illness they have.
Our last question is referring to plant-based nutritionist and plant-based education for our patients and our patrons. Can you comment on, Torrance Memorial, I believe, has a resource with our plant-based green living support group. Do you have any other resources for plant-based diets and how to integrate that with wellness and immune function?
I think plant-based diets are great, and having a diet that's plant-based or is a personal choice. The anti-inflammatory diet does encourage a lot of plants and vegetables, but they also add oily fish as a source of vitamin B12. I think as Americans, we may be eating too much meat. But if you are vegan or vegetarian, make sure you're getting your protein source from lots of beans, nuts, and quinoa is a good plant-based source of protein as well. And make sure you check your vitamin B12 levels.
Great. Well, I want to shout out to Dr. Alexander Spencer. We're so excited to have you as part of our team and resource, because you bring some really good information and on integrative medicine to the plate. So thank you for joining us. We want to thank everyone for being here tonight via your home Zoom. This lecture will be available to view on our website, and we just ask you to go to our torrancememorial.org site for further viewing. We want to thank Dr. Rand for being here, for Grace Sanchez and GrowingGreat. We are looking forward to when we can have you all in our auditorium again and socialize in person. But we thank you for joining us this evening, and take good care.